Infants who were given antibiotics or antacid medications in the first 6 months of life had a significantly increased risk of virtually every single allergic disorder by the time they were 4, including anaphylactic food allergies, eczema, asthma, allergies, urticaria. And why is that? The authors at that time speculated it was because of the disruption to the gut microbiome and how closely an infant's microbiome informs how their immune system should develop.
Welcome back to another episode of the Smarter Not Harder podcast, your home for 1 cent solutions to $64,000 questions. I'm your host again today. My name is Dr. Scott Scher, and it's a pleasure to be back with all of you. Today's episode was very special for me to record. This is with Dr. Elisa Song. Dr. Song is an integrative pediatrician, and she was the pediatrician to my kids when I was in California for many years. So I trust her implicitly, and it was fantastic to have her on this show to talk about her work and her practice. Here is a bio for Dr. Song. She's a Stanford, NYU, UCSF trained integrative pediatrician, pediatric functional medicine expert, and mom to 2 amazing kids. She's on a mission to revolutionize the future of children's health. She has a national best-selling book called Healthy Kids, Happy Kids, an integrative pediatrician's guide to whole child resilience. She's also created a website called healthyhappykids.com, which is an online holistic pediatric resource to help practitioners and parents bridge the gap between conventional and integrative pediatrics with an evidence-based, pediatrician-backed, mom-approved approach. She also has a very large Instagram following too, which I recommend you check out. In her integrative pediatric practice, she has helped thousands of kids get to the root cause of their health concerns and empower parents to help their children thrive by integrating conventional pediatrics with functional medicine, homeopathy, acupuncture, herbal medicine, and essential oils. She's the chair of A4M's pediatric education and has lectured around the world at leading integrative and functional medicine conferences and premier parenting events. She's also been featured in hundreds of top podcasts, print and online media outlets, including the Wellness Mama podcast, Bloom TV, Forbes, Healthline, Mind Body Green, National Geographic, Pop Sugar, Parents, Motherly, Parade, Very Well, the New York Post, and more. So it goes without saying that I trust, as I mentioned, Dr. Song implicitly. She took care of my kids for many years. She has a framework that I love, which is combining an integrative approach to pediatrics. So she's trained in functional medicine, she's trained in conventional medicine, and she uses all of these in her practice. She has written a fantastic book called Healthy Happy Kids, which she and I talk about a lot in this podcast. We talk about how she decided to become a pediatrician in the first place, where she found out about integrative pediatrics, how functional medicine became a big part of her practice. She also discusses in detail some of the things that she wishes she knew when she was just starting out becoming a pediatrician. And then we dive significantly into the gut and how the gut has such a significant impact on the rest of our life, especially if we're getting antibiotics and other interventions like acid blockers when we're super, super young. We then discuss how you can actually optimize or recalibrate somebody or a child's gut if they have to get antibiotics, which we both talk about. She and I had to happen for both of us, for our kids on several occasions, even though it wasn't ideal. It's something that had to happen. So how can you optimize? How can you treat the gut with prebiotics, with postbiotics, with prebiotics, and with obviously probiotics as well? And she talks about various strains that are very important in children that may not be as important or as well understood, at least in adults, but significantly important in kids. And we talk about her framework, which she calls her wheel of gut resilience, and the 5 pillars that she has there, and how all of them are extremely important if you're trying to optimize gut function. If you optimize gut function, you're optimizing overall function. We then spoke significantly about vagal nerve as well as parasympathetic tone, and then how prenatal care in the mom and the dad that are getting pregnant are very, very important as well. Finally, we talked about 3 ways that Elisa thinks that everybody can live smarter, not harder. I really hope you enjoyed this episode with Dr. Elisa Song. It was a fantastic one for me to record. Again, I really love what she's doing. Being a pediatrician and doing her work, especially in California, is not easy. So please take a look at what she's doing and enjoy the show. Take care. All right. Dr. Elisa Song, how are you?
I'm great. It's really great to talk with you this morning after we were rushing around, dropping kids off at summer camps.
As usual in the summer. It's really great to see you. And I think we bumped into each other at the Integrative Health Symposium in February. And what a lot of people I'd like to tell that are listening is that Dr. Song used to be the pediatrician for my kids when we lived in California in the Bay Area for about 8 years. So I think from at least two of them were born, if not three of them, but at least two of them were born there in Belmont, California. So it's really a great pleasure to have you on, Eliza, and to talk to you about integrative pediatrics, because I think that there's very few people in the United States. I think this area is growing, and I'd love to hear your sense of that, but there's not that many pediatricians that are doing an integrative approach and understanding things from this kind of more comprehensive way. And so I want to start off with, what is, in your estimation, an integrative pediatrician, and what was your journey to get there? And in addition, what are the things that you wish you knew when you first started being a pediatrician that you know now, as an overview for people, just to give them like a toss of the situation?
Yeah, there are an increasing number of interested pediatricians, and the number of pediatricians who are actually getting trained and learning an integrative approach, functional medicine, it's growing. We'll get there. It is lagging behind the adult functional medicine world because up until recently, there really hasn't been many venues for training in pediatric functional medicine, which is why I'm so excited that A4M is taking the lead on that. So this is our third annual Pediatric Integrative and Functional Medicine Symposium. And as the chair, I get to choose my wish list of speakers I wish I had these talks when I was starting out. I wish I had 20 years ago when I opened up my practice, had a community and had some mentors, and it's coming. My journey I don't know, it's probably less interesting than many people's because many practitioners who come to functional medicine or find an integrative approach, it's because maybe they themselves or a family member has had a health concern that conventional medicine really failed to get to the root cause and find solutions. And knock on wood, that wasn't my story. It was just, I always knew I wanted to work with children. Being a pediatrician was a no-brainer. I actually first wanted to be, and always my heart has been with children's advocacy. So I was going to be a lawyer. I took the LSATs and I was a public policy major at Stanford, nothing to do with medicine because my mom was an OBGYN growing up. And I was like, I don't want that lifestyle. But then in college, I actually stumbled upon a conference that, as a junior and undergrad, whatever got me to go and sign up and drive myself over to the Santa Clara Convention Center. But it was in the late, I guess this would have been 89 or 90. It was a conference of the American Holistic Medical Association. And I was so intrigued because I'm like, what is holistic medicine? Never heard of it. And so when I went, I heard these speakers that were just getting known. Deepak Chopra, Andrew Weil, Joan Borisenko. And my mind was totally blown. I was like, okay, that's what I want to do. And so my first path, actually, I called Bastyr and I was actually going to apply to Bastyr as a naturopathic doctor. But back then, late 80s, nobody in my circle knew what that was. And they didn't.
You grew up in Jersey too, right? So nobody knew about it on the East Coast at all.
No, and I grew up in New Jersey, right? But especially my mom is a conventional MD. I wasn't dissuaded, but I also wasn't fully encouraged. That's how I ended up in conventional medicine, medical school at NYU. Very conventional and conservative. Extremely. But that informed what I wanted to do. I knew from the beginning of my medical career that I really wanted to do something more holistic, whatever that meant. And then after residency at UCSF, again, I stumbled upon a food as medicine conference flyer. I'm like, food as medicine. Of course, we don't get nutrition education at all, right? So again, this was now in 2000. I went, and again, mind blown. I heard Mark Hyman for the first time, and I learned what functional medicine was, and I never looked back. And so when I opened up my practice in 2004, it was as an integrative pediatrician, pediatric functional medicine doc. I've never practiced any other way except for the time that I was in residency and went back as an attending for a year. I always think about, what do I, as a budding pediatrician who's wanting to help kids and really help them thrive from the inside out. The reason why I wrote my book is because I want every practitioner to understand how important the foundations are of a child's developing gut microbiome, even from in utero, even preconception, to their lifelong brain health, immune health, metabolic functioning, hormonal health, all of that. And we all know that all health starts in the gut, or all
Hmm.
disease starts in the gut, but
Hmm.
we have to really embrace that and start from the very beginning and teach our kids. We need to empower our kids to make these decisions. And so that is my passion and mission in
Hmm.
life. And if I can do that, I will feel like, okay, I've done something good in the world.
Yeah. That's beautiful. It's funny because when you went to medical school and when I went to medical school, I think the only thing that we learned about the gut was that you were supposed to kill things in it with
Yeah.
antibiotics. That was pretty
Yeah.
much it. I finished my residency in 2010. I think I graduated medical school in 2007. I think you're a little bit before that, but there was just no emphasis at all. It's funny also, and I think you'll get a kick out of this, is that one of my teachers was Dr. Alessio Fasano, and he
Wow.
was
He's
very
like
early
the,
in. I know he's the guru now
amazing.
on the gut and celiac disease. So at that point, he
Mhm.
was just getting involved in celiac disease, and we did discuss that. But he was the first guy, and I remember just there was like an inclination of it in his conversations. He's this Italian dude. He's got a thick accent, and just like loves talking. And he was just talking to us about celiac disease and about the gut. And there was like an inclination there that there was something else going on in the gut
Yeah.
other
Yeah.
than just killing it with stuff. And
Well,
over the
and
last, yeah, go ahead. Yeah.
you had asked, because in the book, I write a bunch of things about what
Yes.
I wish I had known when I was starting out and what I want everyone to know now,
Mm-hmm.
parents and practitioners. And it's in the literature. And it's something that I think, of course, the microbiome now is having its day, and you can hardly pick up a journal and not see something about the microbiome. And it's becoming more accepted from a conventional standpoint. And yet still, pediatricians and practitioners have not seen the research about the impact, the lifelong impact of microbiome disruption, and how we in medicine are inadvertently really laying those foundations if we don't know how to restore the microbiome, especially after something like antibiotics. There's one
Right.
really large study. It was a study of nearly 800,000 children, a military study, and they looked at infants who were given antibiotics or antacid medications in the first 6 months of life. This was a study it was published in 2016. So now it's been about 8 years already, right?
Mm-hmm.
What that study found was that infants who were given antibiotics or antacid medications in the first 6 months of life had a significantly increased risk of virtually every single allergic disorder by the time they were 4, including anaphylactic food allergies, eczema, asthma, allergies, urticaria.
Mm-hmm.
And why is that? The authors at that time speculated it was because of the disruption to the gut microbiome and how closely an infant's microbiome informs how their immune system should develop. But it should be no surprise then with this explosion of allergic and atopic disease in infants and children, and also autoimmune conditions as well, because of that
Mm-hmm.
perturbation of the gut immune system connection. We
Mm-hmm.
also know this is a large Danish study, and it looked at mother-infant pairs. And don't quote me on this, but I want to say it was over 1 million births. They have amazing databases there,
Right.
and found that
Socialized system. Yeah.
infants who were exposed to antibiotics, again in infancy, but especially within the first 6 months of life, this includes in utero exposure,
Right.
right? To a mom who's maybe had antibiotics for a sinus infection or for a UTI during pregnancy, or even antibiotic prophylaxis for group B strep during
Right.
delivery. And I'm not going to say don't do that, but when they looked at these infants, that early exposure put them at significantly increased risk for many, if not all, mental health concerns by the time those kids were older and were teenagers. And the
Mm.
more rounds of antibiotics, the higher the risk. We know this from adult literature too, but when we see how much the microbiome informs how your child's brain develops, what synaptic connections are formed and kept, if we want to address this epidemic of teenage anxiety and childhood depression, suicide, we have to start looking at the foundations that are set early on in life, for better or for worse. And if we're going to prescribe antibiotics, which I have a whole chapter in the book on antibiotics called What Every Parent and Practitioner Should Know About
Right.
Antibiotics,
Right.
we want to make sure that we're prescribing them appropriately and also understanding how to do the mop up and restore their microbiome so that they don't have these increased risks later on. And practitioners like you don't have to be loaded with patients who are chronically ill.
It's a big deal. Absolutely. I think the overuse of antibiotics, acid blockers, all different types of medications. We'll go through some of the other ones, but I think it's really important that we stick here on the antibiotics for a minute. Pardon the interruption. This episode is brought to you by Health Optimization Medicine and Practice, a nonprofit association training practitioners on how to optimize health rather than treat disease. Check out the Exposomics module. This module is talking all about toxins in our environment, toxins that are poisoning our ovaries, our testicles, making us less fertile, and more. Go to homehope.org and check out the Exposomic module. Save 10% on this module or any module by using code podcast10 at checkout. Now back to the show. Because number one is that certainly they're overprescribed. We know that. I think, a lot of people, I'm sure you lived in a conventional household. I'm sure it was like something your mom gave you like candy.
Every sore throat, every cold, yes. You're like, okay, here you go.
Yeah, where I grew up the son of a chiropractor because, and in that case, I wouldn't get anything unless I was dying, like absolutely, like almost, if my fever was like over 106, maybe I would go on ice, but that was as much as I would get. So very interesting, right? And how those kind of philosophies differ. I guess the first question I have, and this is going to be good, because as a practitioner, with adults, we think about how we can mop up somebody that needs to be on antibiotics. So certainly our kids will need to be on them sometimes. Certainly adults will need to be on them sometimes. What is your framework of how, and I know you have a chapter, I'd love to go over the overview there. What's your framework of how you think about optimizing or cleaning up or mopping up somebody's gut if you do have to give them an antimicrobial of some sort?
Yeah. And this is even if your child has received antibiotics in the distant past, because a lot of parents will hear some of this information and think back, have a teenager who's dealing with anxiety, and then think back, oh my gosh, was it because of the antibiotics that they got when they were 4 months old? And you can't do that, right? Because it's also never just one thing.
I think, game. Yeah, totally.
Yeah, it's never just that one antibiotic course or that one thing. And I think partly in functional medicine, when we talk about root cause medicine, in a way, we've done a disservice to patients, because then I have parents who are racking their brain trying to figure out the cause, right? And then feeling guiltier and guiltier about it. And it's never that simple unless it's an acute poisoning situation, right?
How do you frame it? How do you frame it then? How do you change that framework? Instead of like root cause, do you have a different way of talking about it with patients so they don't have that worry that it's like that one thing overall?
Yeah. What I talk about is your child's story. We go back in time and we think about all the different factors that got your child to the point where they are today. And when we look at the story, there may be that one thing that was the straw that broke the camel's back. And that's a thing that parents may have in mind. It was that one medical intervention. It was that one thing, right? But there's a whole backstory leading up to that. And if your babies are little, it may be that it was something that even was from generations past. Right?
Sure.
We know that our microbiomes are even transferred transgenerationally. Even grandparents, your grandfather's microbiome can affect your baby's health. And so there's all this backstory. And when we sit together in my office as any integrative functional medicine doc, you're really trying to tell that patient's story and then tell it back to them so that they understand, okay, how did I get here? And then now with that, as a mom, you're never going to get away from mom guilt. It's just a part of being a mom, but it's just, and I tell every patient, every parent, my own kids had antibiotics when they were under 6 weeks of age. Mm-hmm. I was fortunate enough to know that they were absolutely necessary.
Right.
And I was also fortunate enough to know how to do some of that mop up. But it's also, I see kids years down the road, and it's never too late to do that mop up. So that's the message I want to give parents. And the older you are, the longer the dysfunction and the microbiome disruption has taken hold, the longer it might take to get back to optimal health.
Right.
And we see that with adults, right? But
Absolutely.
The beautiful thing about kids is kids, for the most part, tend to move more easily and have lasting healing. But as we think about how do we restore their microbiome health, this is where I call it the gut reset. And everyone's at this point now listening, I'm sure, has heard of the 4 R's, which is now the 5 R's, right, of healing a leaky gut. But when I really frame it as the reset, RE, the re in the reset, is returning to the foundations of microbiome resilience. It doesn't matter how many supplements or antimicrobials or whatever devices you throw at a child or an adult patient. If they don't go back to the foundations, they might get better. Their stool analysis might look perfect after a few months, but they're going to slide right back, right? They're not going to stay there. And we as practitioners, and certainly me as a pediatrician, I've had this time and again where, yay, they're in remission, even from their autoimmune condition or whatever it is, right? But maybe 6 months down the road or a year down the road, symptoms start to creep back. And that's not what we want. We want our patients to understand the foundations of lasting health. And when they hit a bump in the road, how to get back immediately themselves. So the foundations are really what we need to do every single day in a practical way, doable way to keep our microbiome healthy and happy. And that's what I teach kids in the book and also in my practice.
When it comes to thinking about somebody, let's just give an example of, I want to go over your whole framework actually with your wheel of gut resilience, so I think it's really important. But when we're looking at just an example of somebody that was going to be on antibiotics for like a child that's going to be on antibiotics for something, say they have severe, like a pneumonia, or they have a urinary tract infection. I remember having to give my daughter antibiotics for a urinary tract infection.
Yep.
I was not very happy about this.
Yeah.
But like you said, like even like we have to do this sometimes. One of my daughters had Lyme disease as well, and I had no choice but to give her antibiotics for a period of time. And so it wasn't exciting for me. I work with you. We work with obviously understanding how this works overall. If you have a patient that comes in, a child, and you have to do something interventionally, what are your thoughts on how to support the gut, while you're on the antibiotic course, and then what would you do during, maybe after, et cetera, kind of thing?
Yeah. I think that the key is ideally you start alongside the antibiotic course. So not wait. I've had some patients go to urgent care or the ER, and there are an increasing number of urgent care and ER docs in the area who are actually talking about probiotic supplements, who are recommending. But I've also heard from patients that they're being told, oh, don't take the probiotics while you're on your antibiotic course because it can make the antibiotic less effective, or right, which doesn't make any sense, or it's not going to do any good. And ideally, and the studies are mixed. There was one study that looked at microbiome restoration after antibiotics in 3 different treatment arms. One, like no intervention, nothing. Another one was the probiotic supplemented group. And another one was given, I believe it was an autologous fecal transplant.
Okay.
Now, the group that had the fecal transplant had the most rapid restoration of the microbiome. Makes sense. Not going to be easily accessible, to most people.
Autologous meaning it was from the actual person that was getting
from the
antibiotics?
person before the antibiotic course.
Before the
I
antibiotics were given.
believe, and I've spoken with some docs who really think that in the future, if that's possible, if we can collect your own microbiome before an antimicrobial or antacid or whatever microbiome disrupting intervention, and then culture that and give it back to you, because your microbiome looks very different than my microbiome. And what's ideal for one child may not be ideal for another child. It's so clear. It's not a one size fits all approach. There's not a single probiotic supplement that is going to be best for everybody, but we have to make do with what we have on the market right now. So we have the group that, with the fecal transplant. Great. When they compared the group who had no intervention versus the probiotic intervention, this one study, which was small, found that the probiotic intervention group had actually a slower time to recovery of their microbiome, which is really interesting, right?
Okay.
But one thing that was not included in the probiotic supplement was a prebiotic supplement.
Okay.
No, you can't just throw trillions or billions or whatever number of colonies of probiotics into your gut and expect them to just want to stay. They need to have food to grow and colonize. It also didn't necessarily look at the specific strains that are in the literature, at least, known to recolonize after disruption. And this is where strain-specific probiotics, that is really going to be, I think, the way we need to move towards in the future. We need to ask, what's the purpose of this probiotic supplement? Is it to restore after antibiotics? Is it to restore the gut-brain connection and enhance neurotransmitter production? Is it to support immune system functioning against winter respiratory viruses? or is it to reduce the risk? Is it to balance out metabolic processes and reduce your risks of obesity, right? And that is strain specific. In the meantime, now, long story short, right? What I do recommend for patients who are on antibiotics, I do recommend that they start a probiotic supplement alongside their antibiotic course. So not at the same time as antibiotic, but wait at least an hour or two.
Right. So there's a time space.
After one of the antibiotic courses, doses. If it's a twice a day dosing or 3 times a day, it can be hard to get in probiotics after each round. So just do one of them and then continue for at least a month or two. Right?
After the antibiotics
are done.
Right.
Trying to choose as broad of a spectrum of antibiotic strains as possible. Number of colonies isn't necessarily as important. It's not like more isn't always better. In our society, we think more and more, but it's really trying to get as many different strains as possible, including Saccharomyces boulardii, which is obviously practitioners know beneficial yeast probiotic that in children has been found to reduce the rates of antibiotic-induced diarrhea. Also really important for salivary secretory IgA production in the gut, so enhancing immune response in the gut. Lactobacillus rhamnosus GG, so that particular strain is also really helpful and important for gut restoration. It's actually probably the most widely studied probiotic strain in infants and children, but it's got to be the GG form, which you can easily find in over-the-counter Culturelle. No, Culturelle is Lactobacillus rhamnosus GG. Sac boulardii is Florastor. These are the strains that have been studied, and then also including a host of other strains. I'm really big on making sure that kids, especially the younger kids, have a good source of bifidobacteria strains as well. Right.
Yeah, that's probably
one thing we're finding for infants ongoing into childhood, adolescence, even adulthood, the loss of bifidobacteria strains in all of our gut microbiomes is setting the stage for a loss of immune tolerance and increased risk for these anaphylactic food allergies, for autoimmunity. In fact, there was one study during the pandemic that showed that worse COVID outcomes seem to be linked with lower levels of bifidobacteria in adult microbiome. And bifidobacteria require very specific prebiotics to nourish them and nurture them. So we get our probiotic. We have good prebiotics to support the growth of these probiotics. And even there are some considerations for an infant, child, even an adult, to support this bifidobacteria growth. There's a specific prebiotic found in human breast milk called 2FL, 2-fucosyl-lactose. It's the most predominant human milk oligosaccharide found in colostrum. And then it shifts as the baby gets older and your breast milk changes to support the baby. There's something called 3FL and LNNT. But these HMOs specifically feed bifidobacteria. And now we have bioactive manufactured HMOs that also support bifidobacteria. So there are some companies that have this as a prebiotic, either as a standalone or as their probiotic blend. Right.
Gotcha. Is it in like a colostrum typically, or is it in like its own kind of supplement typically?
I don't know that. So colostrum supplements probably do have 2FL in them and other HMOs. I'd have to look though. And also most colostrum is bovine colostrum, and that they don't have human milk oligosaccharides, right? They have cow milk oligosaccharides or sheep or whatever it is. So these HMO analogs, in fact, there was a recent study that found that giving adults with, I can't remember if it was Crohn's or ulcerative colitis, but inflammatory bowel disease could significantly reduce their inflammatory markers. So even having benefits in adults. There was one adult study, it was, I believe, an adolescent and adult study that also found that 2FL supplementation could improve mood. And because of the bifidobacter factor support. So probiotics, prebiotics, and then supporting your gut lining. Because a lot of these antibiotics can also directly harm the gut lining and can either worsen a leaky gut that's already there or trigger leaky gut if your patient hasn't already had one. And trying to use food as medicine, bone broth is great. Quercetin-rich foods. Quercetin actually is one of my favorite phytonutrients that help support the gut lining. Your omega-3s. You can consider giving a little extra zinc. I'd like to often supplement with a little extra zinc because kids are often so deficient or insufficient, and you could consider extra glutamine as well. So that would be the plan immediately. And then we're working on the foundations, right? We're working on,
Yes,
okay, how do we keep them?
because certainly I love what you said earlier about it's a story for people. It's not just one event that typically does it. My father actually always calls it the threshold event, and that can be changed or different for everybody. You came up to this situation. It might happen when you're 3 months of age. It might happen when you're 30 years of age, and you get to this threshold, and all of a sudden things just go down. And it's very difficult to just treat it acutely without thinking about the long-term story and what kind of brought it all about, and working on all the aspects that you do. But one of the things I want to ask you before we get to the whole framework that you have was regarding testing. Pardon the interruption. This episode is brought to you by Transcriptions, makers of precision-dosed, pharmaceutical-grade, and physician-formulated formulas in the form of a buccal troche. For this episode, check out Tromune. Tromune is high-strength cordycepin. This is a cordyceps extract. It is 100 times stronger as an immune system booster than the cordyceps mushroom. It increases deep sleep, it's antimicrobial, and it's going to make you feel better faster. Go to transcriptions.com and save 10% on your order by using code POD10 at checkout. Now back to the show. So I know that in adults, for example, there are certain labs that you can go to that test specific populations, but I'm just not certain what's out there for pediatrics. Because, for example, if I was going to go test one of my kids with a de novo stool test, at least the ones that I know of, they would be testing the normals in that range would be people between 18 and 30 years of age. So it has nothing to do with a kid that's 6 years old. So how do you navigate that? Do you have certain labs that you work with, or what's your framework for that testing part?
Yeah, up until recently, that's all we had, and we just had to extrapolate. And dysbiotic organisms are dysbiotic organisms. So if your younger child has Klebsiella or Citrobacter, it doesn't matter how old they are. We still want to make sure that those dysbiotic organisms are cleared. But what's very different is the just microbial diversity in the gut. And what's interesting is the younger you are as an infant, we don't want a lot of diversity. In fact, that maturation of the microbiome with increasing diversity, which really starts to occur once solids are introduced, when breast milk is weaned, and as kids get older and shift towards a more mature microbiome, isn't what we want when your babies are little. Yeah. For infants, we want predominantly, almost exclusively bifidobacteria. So you can't take then an adult stool test and look at a baby's microbiome. The other thing too is lactoferrin is present in breast milk.
Exactly. Yep.
You know, calprotectin can be found in breast milk. And so if you have an infant with the sky high, and I did this years ago, right? Sky high lactoferrin. I'm thinking, oh my gosh, this infant has so much inflammation in their gut, but they're exclusively breastfed. So we have to really look at that with an eye. And even calprotectin, right? Now, studies of, quote, colicky babies have found that they do tend to have higher calprotectin levels than non-fussy colicky babies. So there is something to that. However, in an exclusively breastfed baby, again, we have to take that with a little bit of a grain of salt. And now for microbiome, and we also know, everyone's heard, okay, first 2-3 years of life, that's the first 1,000 days, the microbiome shifts, and then you hit a more mature adult-like stage at maybe 2.5-3 years of age. Even within that first 2.5-3 years of age, there are different stages of microbiome development. And even after that, in a younger child, toddler age, older child, and adolescence, we're identifying these different microbiome patterns. And Tiny Health is a microbiome testing company who is just investing so much in research and analyzing their young infant and child populations to get normal values. And I want to disclose that I am on the advisory board for Tiny Health, but it was so important to me to find a testing company that really has pediatric specific markers. Let's face it, Pediatrics is on the bottom of the barrel of priorities for research funding, for functional medicine companies to look at, supplement companies, right? I've had many supplement companies tell me we don't want to expand our pediatric line because kid supplements don't sell. I'm like, oh my gosh, okay, then how are we going to get our kids to the place when they're not to optimal health? And I work with Tiny Health to actually incorporate some of the other microbiome function analyses. So we are hopefully going to get more data on that as well. What is an appropriate pancreatic elastase for a 2-year-old compared to a 20-year-old or a 60-year-old? But their microbial analysis They use shotgun metagenomics, which is much more accurate than even 16S sequencing. And they have identified different microbiome signatures that may increase the risk for your child developing eczema or ADHD or autoimmunity. And so then we have these points of intervention for that. So that's what I would use for stool testing. For urine organic acid testing, it is one of my favorite tests to run because it's so easy for kids. For a kid who's not potty trained at night and wearing a diaper, I put urine bags overnight, or we've tried even putting cotton balls in the pull-up and then squeezing out the cotton afterwards. All sorts of different tricks, right?
Yeah, sure.
But even then, are those markers? I've been doing this for 20 years now, so I can look and see, okay, yes, this does fit with what I've seen in the past for kids who have signs of mitochondrial dysfunction or neurotransmitter imbalance. We're not quite there yet with the other functional tests. Blood tests are the optimal values for kids and adults for blood testing. I really don't think differ in the sense that you would, for your patient with their 25 hydroxy vitamin D, I would want a kiddo to be maybe 60 to 80, and the same thing for an adult. So blood values are not going to be too different. So we'll see at some point. This is my mission: make pediatrics a priority. It's varied. Pediatricians need more support. And this one study looking at, it was a survey looking at life satisfaction and burnout. And pediatricians are one of the top specialties to report being burned out and not satisfied with their careers. And that's heartbreaking, right? You're taking care of this newborn with this potential, amazing potential in front of them. And then to feel you can't find satisfaction in the work that you're doing. So we need to really reinvigorate pediatrics because this is the future we're talking about.
Yeah. I think it's from a salary perspective, I think pediatrics is always the lowest, right? As far as the salaries of those who finish residency.
It is the lowest. And this was the first year. I believe that this year during the match, pediatrics had really the highest unfilled spots in the country, right?
Yeah.
Especially when we're thinking about primary care pediatrics. It's not to go through all of that and then not be able to financially sustain your debt and your current family. It's hard. It's really hard. And pediatrics doesn't have procedures. Bottom line, right? You get paid for procedures. And that's why in pediatrics, and also kids, again, are reimbursed at a lower rate. Why a pediatric well visit would be reimbursed at a lower rate, I don't know. There's so much you can do in that visit. And I remember when I was starting my practice and looking at reimbursement rates for things like urinalysis in the office, right? A urine dipstick, right?
Sure.
And what was shocking, in San Francisco, there was an HMO called Brown and Toland, but they actually reimbursed almost twice the rate for urine dipstick for an adult as for a child. I'm like, it's the same dipstick, right? Like, how is that?
Just because they're smaller?
Does that make sense? So unless we're really going to prioritize kids' health, it's going to be an uphill battle. I know I have to have hope we're going to get there, but
yeah. It's been a journey, and certainly on the adult side of things, as an internal medicine physician working as a primary care physician, it's not like a whole lot of a better situation. Certainly there is mildly more reimbursement, but being in the system is very difficult, right? We have, if you're a primary care doctor, a primary care pediatrician, what you have 15 minutes with your patients and that's it. And a lot of that visit has to be very specific, related to what you have to do, or else you'll get docked money from a lot of these hospitals or other groups, because if you're not doing very specific things, talking about specific things. As an adult, it's cholesterol, probably. As a pediatrics, like, you have to have well child visits for vaccinations and all those kinds of things. Like, where's the time for everything else?
I know.
And this is what I love about your framework, though, Eliza. So, like, when talking about, you have this cool framework you call the wheel of gut resilience. And I would love to talk about it, its component parts that you feel comfortable, that you feel like would be helpful, because I think, like you said, it's about, there's the acute interventions when we have to help somebody with their gut if they're being on antibiotics or something like that. But what is this is the long-term strategy, right? The gut of wheel resilience, right? So tell us a little bit about what that means and how you present it to patients, or how you present it to, clinicians as well.
Yeah. So I have a diagram. And I'm a very visual person. So I had an
Yes.
amazing graphics person who made
It's a
visuals for
diagram
me.
right here. There it is.
Yep,
Looking at
yep,
it. There
with
it
the
is.
happy gut. And kids love these visuals, right?
Yeah, yeah.
Because you remember,
Adults
and
do too,
adults
though.
too.
Yeah, yeah, yeah.
Yeah, it's true.
Yeah.
And so the wheel of whole gut resilience, the reason why I frame it as these 5 things that we are already doing every single day. But if we learn how to do them like a gut hero, we can create microbiome magic every day. And so we're framing in that way. And we're all busy as parents and practitioners, and kids are busy nowadays. So I framed it in these 5 things because these are 5 things that we already do. So it's not an add-on. I'm not asking parents and kids to do one more thing. I'm
Right.
just saying, look at what you're doing already. We have to eat every day. We have to
Yeah,
sleep
yeah.
every day. We have to move our bodies. Even if we're couch potatoes, you're moving. We have to hydrate and we have to sleep. We have to breathe every day, right? And so all those 5 things. But if we frame that in, what is the research behind how those things can affect your microbiome positively or negatively? And how do we make those little tweaks so that we are supporting and nurturing those trillions of tiny friends in our tummies?
Mhm.
And when our kids know, I have this analogy in the book of how on Earth Day, right? We're all supporting and trying to protect our ecosystem. And kids learn that from the very beginning, right? They learn how to reduce, reuse, recycle, and all the things. And they're learning from early ages about how our ecosystem around us, that we're not taking care of it. So eventually our ecosystem can't support us. And so when they learn that there's this tiny but powerful ecosystem inside their gut whose sole purpose is to keep them healthy and happy, it makes doing these things, puts them in a different light. It's not just for me, it's for my friends in my tummy, right?
Mhm.
And so the 5 things, I put them in a wheel because it doesn't matter where you start. You just start one place, and with every step forward, the wheel keeps moving forward. And so what are the 5 things? Of course, how we nourish our microbiome. And nourish, I put into 2 different parts. So nourish part 1 is all the things that we want to think about getting into our bodies. So fiber, phytonutrients, fermented foods. And with that, I give really fun, practical tips. So I talk to
Mhm.
kids and parents about how do we think
Mhm.
about making every meal or snack pop with plants on purpose, because it's plants that will feed our microbiome. So that I've had little toddlers, parents calling me and saying, oh yeah, my 4-year-old asked my husband in the morning, are we going to make it pop, Dad? Just making it this fun, because let's face it, if it's not fun, we're not going to keep doing it.
Sure. Absolutely. Yeah.
Part 2 of Nourish is, what do we need to keep out? What are our biggest microbiome mischief makers in our foods? And sometimes this is an easier place to start with, because if your kids are like no to any green thing on their plate, it's a bit more of an uphill climb. You can still get
Right.
there, but it's a little bit tougher to think about. And I don't want
Right.
this to be stressful. So then if your kids are eating a lot of packaged foods, or you're buying like chicken nuggets or mac and cheese, there's no judgment. But if we learn how to read every single food label, be a gut hero food label detective, bring our kids on board, then we can already start to remove some of the stress that's disrupting your microbiome. So I give 3 different things to really look at. One of them is looking at added sugars, because
Right.
nowadays it's recommended by the American Heart Association that kids have no more than about 25 grams of added sugar in a day. 25 grams is about 6 teaspoons. Okay.
Okay.
Under 2, you should have 0 grams of added sugar, right?
Yes. Yeah.
And this is the upper limit. This is not, you do not have to have 25 grams of added sugar, right? I
Yeah. And this
point
is the
out,
American Heart Association, which I don't believe. But anyway.
yeah. If we think about 100 years ago, the
Right.
average American was eating maybe 2 teaspoons of added sugar in a day, because you need a little sugar to make the yeast in your bread rise.
Yeah.
And we don't want life to have no sweet.
Yeah.
But
Yeah.
nowadays,
Yeah. Exactly.
kids, teenagers are eating on average 34 teaspoons of added sugar a day.
It's crazy. Yeah.
34 teaspoons. And so I don't talk about it in terms of grams, because that's too nebulous,
Nobody
right?
understands that. Yeah.
But
Yeah.
when
Sure.
teenagers or kids like middle schoolers are from me, they're like, there's no way I'm eating 34 teaspoons, because they think about shoveling teaspoons of white sugar in there. But then I have a worksheet, your daily added sugar inventory. You just take a typical day, don't change anything, but you just look at every package and look at, okay, that strawberry Greek yogurt I'm having in the morning. You write down how many grams of added sugar that is. The sandwich bread, how many grams of added sugar, and you just go through. And I give an example of a typical day for my kids before I was really reading every label, thinking I was doing a great job, right? As a holistic pediatrician, buying the whole grain multi-seed bread with one slice actually has about a teaspoon of added sugar, right? We don't need that, right? But I didn't know, right? And so I've had even practitioners, physicians who have reached out and said, "Oh my gosh, your sugar inventory was so eye-opening because like you, I thought I was doing a great job and I couldn't believe how much added sugar was sneaking in." So we have to know where we're
You
starting
have to be
from,
so careful.
right?
One
And the
question I did have
kids can,
one
which
question
one?
I like before I just have one question quickly on greens, because one of the things that I've heard at least is that young kids are programmed to not like green vegetables and bitter things because there's a higher risk that they would get sick from them, at least back in the older times kind of thing. Is there any truth to that? Kids taste, I've at least seen in my kids, right, where their taste receptors at around maybe 10 to 12 seem to shift, where I can get them to eat broccoli, I can get them to eat green beans or something. But is there any truth to that kids at the younger ages are not like
Yeah, I mean,
evolutionary
that's
programmed?
fascinating. I don't know if there's any truth to that. It's interesting. There's an old Chinese saying when I was learning acupuncture, the professor said that in the old days in China, the first golden seal, a similar herb to
Yes,
golden seal, if you've ever tried it in tincture
berberine.
form, it's so bitter,
Yeah.
right? These yellow herbs are some of the most bitter herbs with berberine in them, right?
Mm-hmm.
They said that in China, they would give a drop, like a little dot of, I think it was golden seal on a newborn's tongue, because if the first taste of life was bitter, then everything else would be sweet after, right?
Ah,
Like,
got it.
so fascinating. But what's really interesting is that what mom eats while she's pregnant and also while she's nursing can impact your baby's taste preferences. There was a study
Right.
looking at moms who were told to eat a lot of carrots, right? And carrot juice and or garlic, right? And then the other group was told to avoid, and their babies who had this intervention smiled more and wanted more of the carrots or the garlic. And so I don't know if for sure taste will mature and change over time, but I
They
also
do.
think
Yeah.
it's a lot of it's just exposure over time and even in utero.
Yeah, that's interesting. Yeah, I have heard those studies where, if the mom was eating very specific things, that the kids tended to more specifically gravitate to those as well. But I've seen it in my kids where, nobody wanted to have any vegetables at all until they got to a certain age, at least most of my kids. And then after that, like eventually you start convincing
Yeah.
them. It's more of a cognitive, you need to eat this for your microbiome, or not using that word
Yeah.
or something.
Yeah.
But then they're more like, look, not everything in life is going to taste like ice cream. So maybe we could eat other things
Yeah.
that aren't ice cream. So that's what I can tell my 7-year-old, or actually that's my 9-year-old, who's tends to be very picky. And then I'd be, look, kiddo, you can have something that doesn't taste exactly like you want it to all the time, can't you?
That's right. Yeah. And it is true as they get older, even if your kids are, this is where, even from the time kids are toddlers, talking about the superpowers of different foods and different colors and microbiome is so helpful, because even if at that moment I still don't want it, that's okay. They're hearing and they're learning. And at some point it does click. It's not an instant thing, right?
Right.
For
Yeah.
some people it is, but it is that journey. And you want to lay those foundations on so that when they go off to college or they're young adults living on their own, they understand the why of making these
Yes.
decisions, so
Yes.
that it's not just, so I'll eat that salad because mom is making me. It's no, I'm doing it because I know these are my goals for clearer skin or better sleep or not feeling as anxious. And I see it in my son right now, he's 12 and a half. Actually, he's almost 13. And he's a meat guy. Like, he would eat red meat like all the time. And
Yeah.
he does eat his vegetables, but that's not his go-to.
Right.
And so what's really interesting is he's been getting into more and more fitness, and
Okay.
he's using the free weights in our garage.
Yeah.
And so he's looking at nutrition in a different way.
Yeah. Yeah.
And so he's going back to some of the things that
You guys had
we've
spoken
spoken
to.
about.
Yeah.
And
Yeah.
yesterday night, literally at dinner, he's, "Hey, Mom, Dad, can I start meal planning over the weekend? And you can help me think about what would be best." And I'm like, "Yeah, sure."
That's awesome. Yeah.
Go ahead.
Yeah. It actually reminds me of a question I have for you as well. This is something that I get, and I think it's an interesting question, right? And there's some politics here, so I'll leave you with however you want to go with this, but there are certain thoughts that should a kid be a vegetarian? Should a child be a vegetarian? Should a child be a vegan? I don't think most adults that are carnivores are making their kids be carnivores and not just eat meat or just eat meat, or go ketogenic. Do you have any sense of some of these more extreme diets or maybe not as extreme for some people, like the vegetarian diet in children, in infants, in adolescents, or what is your sense of all this?
The microbiome.
Right.
There's just no, for in a positive way or a negative way. And it can happen really rapidly. Even within 48 hours, you can see some microbiome changes,
right,
depending on what you're eating. And this is where, as a parent, you also can think, okay, even if your child's microbiome or your own was disrupted significantly in the past, that set some of the foundation, but there's still so much in our power, including what we put in our mouth, that can improve our microbiome. Now, and then I look at, what do kids need? Infants, toddlers, they need a lot of healthy fats. So in a vegan diet, it can be really challenging. But
right.
So then you have to just be mindful of loading in avocados and nuts and seeds and coconut oil. You have to do it really mindfully. I think it's very challenging to get enough protein and healthy fats in if you are vegan and even vegetarian. And it's not impossible, but it has to be done very mindfully, because I have a lot of teenagers who also at some point, or elementary, middle school kids who, for quote, ethical reasons, decide, I'm going to be vegetarian. And then we have to go into the whole conversation about, well, let's think about how produce is grown and what that means for the animals that on that farm. Right.
Yeah.
And so it's really having kids and families make decisions on knowledge. On the other hand, with a strictly carnivore diet, it is real. Your microbiome needs plants, right? They need fiber, which you can only get from plants. Our epigenetic profiling requires phytonutrients, these polyphenols, which are from plants. So I haven't wrapped my mind around how you can really get all of the nourishment that your microbiome needs to support you. Understanding the foundations for adult and child health on a carnivore diet. Bottom line, I think variety is really important. In the American Gut Project, it really looks like the most microbial diversity is going to be found if you have 30 or more different plants per week.
Yeah.
And for some, they're already there. For some, it's a goal that you work towards, but it's plants. And even I'm just looking at, we were talking briefly about what do we know about impacting telomere length in pregnancy for your babies? And one of the things that I found was that moms who were on a more Mediterranean diet had babies who were born with longer telomere lengths. And again, I think variety is really the key.
I know we have so many things we could talk about. I have so many things I want to ask you, but when it comes to that aspect of it, which is prenatal health and the health of our children, certainly you just mentioned, of course, how diet has an effect on this. I know you've been diving deep into this topic. I wanted to know, I know you're thinking about doing more work on this as well. What do you think are some tidbits for those that are looking to get pregnant, or male or female? What have you been seeing? What have you been looking at on the prenatal side of things that seems to be very impactful overall? Because of course, mostly adults are going to be listening to this podcast. They have children. Some of them are going to be thinking about having children. And then that prenatal period is extremely important. And so many of us are so much more toxic now just because of our exposures. What are your thoughts there, if you have any, that you could enlighten us with over on that side of things?
Yeah. I would say the two things to work on: preconception. And I say ideally preconception, right?
Yeah,
ideally, you would take 3 to 6 months to the paternal and maternal partners to really do some cleanup. Number one, with your microbiome. And that includes those 5 things, right? So already, if you think about nourishing your microbiome, you are eating in a different way, with lots of fiber and phytonutrients, and you're working on optimizing sleep, moving your bodies, staying hydrated, and regulating your nervous system. Simply by doing that, your sperm quality is going to be better. Your chances of getting pregnant is going to be easier. Your baby's epigenetic future is going to be brighter. So really, microbiome is so key. And then with that, as you said, so many of us are really toxic, and we are not ever going to be, unfortunately, toxin free if
Right.
living anywhere in the world, I would say. It doesn't
Right.
matter
Right.
where you go, right?
Absolutely.
These forever chemicals and microplastics, they are in us for good,
Yes.
right?
Everywhere. Yep.
And no matter how clean and green we try to live. And so we still have to try, right? But many of these endocrine disrupting chemicals, in fact, I was reading this one article that was fascinating that the researchers are proposing that they shift the term to microbiome disrupting chemicals
Mm.
because they can
Mm.
clearly impact and trigger gut dysbiosis and leaky gut. And that is what impacts your gut hormone estrogen metabolism, because so much of that occurs in the gut. And
Right.
so, we want to really try to lower our toxic burden as much as possible, especially as women who are going to carry babies inside of us, because we found, unfortunately, all of these toxins in cord blood, in the placenta, and in our breast milk.
Yeah. And
So we are
microplastics too. Yeah.
inadvertently lowering our toxic burden when we're pregnant and nursing. But we want to start off with as low as possible. And then working on vagus nerve regulation, nervous
Mm.
system regulation. I think that if all of us as children and adults focused on microbiome optimization and vagus nerve regulation, we would all be so much healthier for the long term. And when we look at the effects of prenatal psychological stress on your
Mm-hmm.
baby's epigenetics, not just on their HPA stress response, but also their future risks for metabolic syndrome and diabetes and immune dysfunction. It's not to stress a pregnant mom out even more, but it is to say that is a priority, right? And so when you feel just, I'm too busy to take the time to practice some breath work or practice some meditation, that actually, for me, is more important than probably any supplement you can take. You're just not going, yes, you want to take your folate and your choline and all of that. But if you really want the healthiest baby possible, you need to take the time out for self-care
Right.
and nervous system regulation, right?
Yeah.
That self-care is baby care.
Yeah. I talk about this all the time with my patients is that if they're always sympathetically driven, they can never heal. They can never really grow. They're always going to be in more of a catabolic state because the body's always trying to fight itself or fight whatever they think or the body thinks that you're trying to fight or whatever it might be. So your nervous system regulation, I think it's huge. I know you have a number of different ways that you talk about this with kids, and I think it's something that all of us should be talking to our kids about early. Do you have any tidbits or quick tips for parents that are listening, some things they can do with their kids to help with learning nervous system regulation at a relatively early age?
Yeah. And that is one of the 5 things, right, for
Yes, one of your
microbiome
fives. Yep.
magic. And I
Yep.
have a whole chapter called Breathe, which is really about this vagus nervous system regulation. And what I talk to parents and kids about is really looking at this as one of the most important sort of prescriptions I could give to them. And I try to move it away from talking about mindfulness and meditation, because a
Right.
lot of kids now in school have SEL classes, right? Social emotional learning classes.
Yep.
And I'm not going to say all, but invariably it is the class that when kids are talking about or teens are talking about, they're rolling their eyes a little bit about, right?
Yep.
Oh yeah, we did yoga today, or oh yeah, we did some meditation.
Yep.
And so I'm so glad that schools are talking about this, but it still is in kind of the woo-woo space, right? And we got to make it more scientific. We have to make it more research-driven and more tangible for people, because that's when they're going to do it. And so what I let parents and kids know is, look, when we're doing the breath work or taking time to have mindful moments or meditate, it is great that you feel relaxed and calm and focused and in the zone or whatever, but that is really a beneficial side effect of all of this, right? The real benefit is that it lowers chronic inflammation, it regulates your immune response, it balances your blood sugar, it regulates your hormones, all of these downstream effects. And that's why I want you to do it. It's not just to feel good. Like I want you to feel good, but it's really
Yeah.
because of these underlying health impacts on virtually every single organ system in your body.
Yeah.
Right.
Yeah.
And so,
Yeah.
one of the things, the reason why I call the chapter Breathe is because simply learning how to engage your diaphragm and do belly breaths throughout the day, not breathing with your shoulders, is one of the best ways every single day to get back into the parasympathetic. after
sure.
when you're
Yeah.
stressed about making it to school on time, or your friend said something mean to you, or whatever it is. Really just focusing, breathing together. So many adults, parents in the practice, when I sit there and I'm demonstrating belly breathing, diaphragmatic breathing, they can't do it either. They're
Right.
as you're taking a breath in, they're concentrating and they're pooching their bellies out, or they're really working because we've forgotten how to do it. That is one of the skills that's free to do. You can do anytime, and it's something that your kids, if they learn now how to stop in the moment when they're stressed about something, getting into that sympathetic, pause, take 5 or 10 deep belly breaths to regulate their nervous system and then move on. If they learn how to do that when they're young, they're going to have such an easier time as life just piles on
Yeah,
the
I talk about it.
stressors.
Yeah, being a superpower for my kids, right? The
Yeah.
superpower to be
Yep.
able to regulate your own nervous system pretty much on demand is something that all of us could likely, I know all could benefit from as kids, and as especially as we get older and things get more complicated. But this has been great. Eliza, thanks so much for spending so much time with us and with me. I have so many more questions I wanted to ask you about Tylenol and fevers and proactive integrative care, but they can all get all that information from your book, which is great, and finding an integrative pediatrician to work with. Just to finish up, I ask people one more question. I didn't prompt you before. It's not a challenging one. It's just as it's really the name of the podcast is Smarter Not Harder, the Smarter Not Harder podcast. And we ask all our guests, what are 3 ways we all can live, or maybe in your case, our kids can live smarter, not harder? And I think you've already given us a lot of these. But if you had the top 3 easy tips for parents or adults, what would those be in your case?
Yeah. I guess tip number 1 would be to start your day in the tone that you would like to set for the rest of the day.
Sure.
So whether that means, for me, it's actually waking up a little bit before the kids and having just 10 minutes alone with my cup of coffee, doing a silent 5-minute breathing exercise.
That's beautiful. Yeah.
So I'd say that is just when you can set the
Set the
tone for
tone.
the
Got it.
day,
Mm-hmm.
first thing. The second thing, read every label. If you read every single food label, it sounds like a big task, but as soon as you know how to do it, it's automatic. 2 seconds, I'm putting that back, right? 2 seconds. Oh, this looks like a keeper, right? That's going to make your life so much easier, right?
Mm-hmm.
And the third tip, go to bed earlier than you think you need to. Like, just prioritize.
Are you talking to me
sleep.
this time? What? Just kidding. No, I try to tell my kids that all the time too. I love it. It's a great tip. Okay, so where can people learn more about your book, your work, Eliza? Websites and locations would you like people to go?
The book, Healthy Kids, Happy Kids, it is available anywhere books are sold. So wherever you love to buy books, of course on Amazon, but it's Barnes & Noble, lots of local bookstores. I love supporting our indie books. So there's that. There's a lot of great resources and handouts in there that practitioners can use in for your patients too. Best place to find me is my website, healthykidshappykids.com, and also on Instagram, which is healthykids_happykids.
Yeah, you're very prolific there and have a great site. And I really appreciate, as always, all the work you're putting out in the world. Eliza, thank you. It's not easy being a pediatrician, integrated pediatrician, especially in California, of all places. And I know you've had to work hard to do what you do. So thanks so much for spending some time with us. And I wish you a fantastic rest of your day.
Thanks for having me, Scott.
Okay. I just pressed the wrong button. There we go. Thanks so much for tuning in to another episode of the Smarter Not Harder podcast, where we give you 1-cent solutions to $64,000 questions. And in this podcast, man, I had so much fun speaking to my former pediatrician for my kids, Dr. Elisa Song. She is a wealth of information. Her book is fantastic. I really encourage you to go check out her website, her book, her Instagram. And if you like this podcast, don't forget to like and subscribe below. Tell your friends, tell your family, and we'll see you soon.